about 50-50 private and public. ICMR collaborated with Bharat Biotech, a great collaboration, public-private. We got the vaccine. But when it came to administering the vaccine, we had 1 lakh centers, 98% of them were in the government. If we look at trials, and India, I think, has witnessed more trials. We've actually worked towards developing vaccines, medication, and so on. It's again public-private sector coming together. And, one very interesting data point that, we look at publications and evidence in medicine. So today's day 908 of the pandemic, and there are about 390,000 papers on COVID on PubMed. Mm-hmm. India has 14.1% of those papers, and many of those papers would not have come into existence if the public and the private sector had not come together. So I think that's a big takeaway, and that's going to serve the country really well in the years to come.
So, as you said, this is essentially a wake-up call for public health experts and policymakers. No one around the world expected a pandemic like this one to come along, but when it did, a lot of countries reacted fairly quickly, especially if you look at the pace at which the vaccines were developed and approved. We really crunched time. These are long development processes which take as much as 10 years in a normal course of trials. But we were able to reduce it remarkably to just 18 months. How would you rate India's response and the public policy action that followed the pandemic? Because you were right in the middle of it. And like you said, scrambling for oxygenated beds, for oxygen cylinders, for medicines, for PPE kits.
I think if you look back and see India's overall response, I think we did really well. Look at the size of our population, look at how diverse the population is. We have patients or individuals living in far-flung areas. So it really was about using technology. Let's start with Arogya Setu. It had 100 million downloads in 14 days, the highest ever for any app. Just goes to show the power of the new India. People went on, downloaded the app and wanted to know more about COVID. We created an AI-based COVID risk score because people wanted to know, do you think I have COVID? Because I got exposed to someone who sneezed in front of me. It had 16 million downloads. So I think technology served us really well. Look at COVID. I was traveling overseas and they asked for a paper copy of your vaccine certificate. And then I traveled to Bombay and I didn't know that I had to carry my vaccine certificate, but all I did was show them the app. And there it was. So I think we've done really well using technology to our advantage. But I think the spirit that India has, that, we can overcome challenges because of the resilience that we have. We understand frugal innovation. I mean, you look at the tests that we use, the diagnostic tests. Look at the cost of our vaccines. Look at the fact that we made no PPEs and then became the second largest exporter of PPEs in the world.
Right.
I mean, look at the way medication production, delivery happened. The way we connected with technology through eICUs. No country will have enough intensivists to manage ICU beds. But we achieved that through technology, whereas one doctor could manage 300 patients across 12 hospitals sitting in front of his computer where he has images in front of him of what is happening real time, what's happening to the pulse oximeter reading, what is happening to the ventilator settings, sitting in one location. So I think we did very well. And I want to talk about mortality for a second because a lot was written about it. Please, let's look at mortality rates in countries that had very large numbers. Our mortality rate was the lowest. If you look at, for hospitalized patients, you look at per 100,000 patients who were infected. So I think overall we did really well. And of course, the icing on the cake is the fact that, 87% of our population is vaccinated, fully vaccinated, with 195 crore vaccines being administered. 5 million, a day on an average, more than the population of New Zealand.
That's
so
true.
I think we need to sometimes look at data and say, hey, listen, as a nation, we did really well, and be proud of the fact, because you go overseas and address medical gatherings, and they really are very impressed in looking at the scale of what we did and how we achieved it. And you look at the costs of what it cost them to manage a patient in an ICU with COVID and what was our cost.
No, absolutely. I don't think there's any doubt about that. And also the fact that given the population density of our major cities, the fact that we didn't witness more deaths, or it wasn't like at the beginning of the pandemic, a lot of countries had predicted that India is probably going to be a disaster. It's going to be a COVID disaster zone. But we proved the world wrong, right? But I'm sure there are hardly any families here whose lives were left untouched by COVID. So I think the question which they would naturally ask is there more to be done to increase the healthcare infrastructure in this country, whether it is hospitals, because I'm sure a lot of families would not be able to afford the kind of care that, let's say, you can, as Apollo, offer. This country needs a lot of public infrastructure investment in healthcare. Do you see more of that coming? We know that in this budget, an 83,000 crore allocation has been made for healthcare, but given India's scale, is that enough? What are the models that we can potentially employ to make healthcare affordable and accessible to everyone?
Absolutely. I think there is a need for us to improve infrastructure. We need to enhance human resources. We need to deploy technology more effectively, and we need a 360-degree approach. And I want to here again review some of the initiatives that have been taken in recent years, and I think we in the healthcare community are very, very appreciative of that. Well, the National Health Policy talks about our GDP spend on the government side to get to 2.5% by 2025. Well, we hope that that is fast-tracked, because we used to spend something like 1.1% of our GDP from the government side. The total spend was about 5.5%, so the vast majority was private. So that equation needs to change, because we need to invest more in infrastructure, public health. But I think you raised a very important point, Sridharan, about access, and with access comes affordability. And for affordability, I think the Ayushman Bharat PMJ scheme, which is the largest scheme of its kind in the world, and we know that there are 18 crore sort of individuals who've been enrolled under it. Apparently, by March end, it'll be 30 crores. 25,000 crores have been spent on care, which is very positive. I think the whole digitalization is going to be very important. There are about, I think, 22 crore health records that are available. We have Ayushman Bharat digital mission about the professionals being registered, the institutions being registered. We also have the Ayushman Bharat infrastructure mission, which has an allocation of 64,000 crores. And very importantly, in 600 districts, 30,000 ICU beds will be built, because that is a gap. There are also going to be centers for disease control that are going to be established. And I think with all these initiatives, we will have a situation where the common man can afford care. Because see, healthcare in India is very advanced. But the key is that it must get to the person in the villages. Gandhiji had said the future of India lies